Everybody will have in mind, but it depends upon so many factors. Type 1 diabetes idre, insulin is a must. Type 2 diabetes idre, you can manage with diet and exercise. Some set of population will require medications. Initially, we can manage them with medications, but over a period of time, on 10 ವರ್ಷ ಹಂಗೇನಾದ್ರು ಶುಗರ್ ಮೇಲಿದ್ರೆ ಅವಾಗ probably they will require insulin. So each person his own. So there is no general classification for these kind of patients, and we'll have to individually stratify the patient whether you require insulin or not. But general ಆಗಿ ಮಾತಾಡಬೇಕು ಅಂದರೆ ಯಾರಿಗೆ HbA1c uncontrolled, that is more than 8 ಇದ್ರೆ, even after 3 to 6 months of taking medication, he is likely to go on insulin early. Today I'll be talking about diabetes in women. It can be classified into two groups. One is diabetes in women, diabetes in pregnant women, and also in the elderly. So diabetes in women as a general, we have to be very careful and we have to monitor like patients who are having diabetes in general. Women of childbearing age or women who are pregnant have to be monitored for sugar levels, because diabetes in pregnancy have to be monitored very closely, and they have to be given insulin, and their weight also has to be managed. Next is elderly women. Elderly women are very prone to develop heart problems, to develop bone problems, to develop kidney disease. So in that view, we have to monitor the sugar levels. And as a general population, women are more prone for anxiety and depression. So diabetes, whenever a woman gets diabetes, we'll have to be a little more aggressive and we'll have to control it accordingly. Diabetes, as we all know, is a very common problem, and day-to-day problems are known in diabetes. One of the major complications of diabetes is hyperglycemia and hypoglycemia. These two are considered as the diabetic complications which require emergency treatment. Hyperglycemia is increased sugar levels more than 600. Hypoglycemia is low sugar levels less than 50. Both need very active intervention. If the patient has high blood glucose, we need to admit the patient or have to control the sugars at a very aggressive rate by giving insulin. If the patient is having a low sugar, then we need to give him sugar supplements and to monitor the sugar levels on a day-to-day basis. Both needs active intervention, otherwise it's going to be very difficult for the patient. So if you are suspecting a high sugar or low sugar, bring him to the hospital at the earliest and give him treatment at the earliest. Diabetes in pregnancy, which we also call as gestational diabetes, is a separate entity. It doesn't come under the type 1 category or type 2, but it's a separate subset. Type 2 diabetes women can also develop diabetes in pregnancy. Basically, these women have to be monitored little more aggressively than the normal women. They have to be given a very good diet advice, and if the sugars are uncontrolled, if the HbA1c is uncontrolled, if the sugars fasting is more than 95, any sugar is more than 120, they have to be treated with insulin. There are very less tablets which we can give during pregnancy because of the risk for the child. So they have to be given more of insulin, and we'll have to manage it very aggressively. And dietitian is the core for management. They have to be on a regular basis. They have to keep in touch with the dietitian, and we'll have to manage accordingly. So diet in diabetes is different for type 1 diabetes and type 2 diabetes, but today I'll be talking in general. So whether it's diabetic patient or non-diabetic patient, the general guidelines is the patient has to take 50 to 60% of complex carbohydrates, 20% of fat and 20% of protein. This doesn't change. What changes is the quantity and also what type of food he has to take. Generally, we ask them to avoid simple sugars, which has to be avoided, like sweets and simple sugar. Complex carbohydrates, they can either take rice or they can take ragi or wheat, doesn't matter. All have the same glycemic index. When it comes to fruits, they have to basically avoid mango and sapota because they have a very high glycemic index. They can take papaya, orange, apple, musubi, guava on a regular basis. Along with this, they always require some high protein because Indians are deficient in proteins.